So what's my experience with cataract surgery? It's been an incredible journey. My friends who are non-medical, in fact, even my friends from medical school who've become orthopaedic surgeons, gastroenterologists, they don't understand my relationship with cataract surgery. It's been a relationship that's lasted over 20 years because I knew that I wanted to be an eye surgeon when I was 21 and I was an undergraduate at Cambridge. And so I was incredibly excited the first time that I saw a cataract operation and the first time that I began to learn the steps. So I completed my first cataract operation in 1997. This was 20 years ago now. So I've done a lot of them. And I was incredibly fortunate in my first ophthalmology job at the Sussex Eye Hospital in Brighton. I had amazing teachers who were really at the forefront of the revolution that had taken place in cataract surgery technique. And that revolution was in the mid-90s, the introduction of phacoemulsification. So this was a completely new way of performing the surgery. Up until then, it had been a large incision. The cataract itself was prolapsed out of the eye, a lens placed and the large incision stitched up. With phacoemulsification, we were using a small ultrasound probe introduced through a tiny incision and a series of delicate maneuvers to liquefy and break up that cataract and aspirate it through that tiny port. And it was a completely different skill set. There were many surgeons who retired at that time because they were in their 50s and were struggling with learning a completely new set of skills. So I was very fortunate to be working with these doctors who'd already embraced that technology. And within a year of my training, I was able to operate independently, albeit I was given, understandably, the more straightforward cases. But nevertheless, I had my own Mr. James Ball cataract list a year into my training. What this then meant was that when I moved on to other hospitals later in my training, I occasionally found myself teaching the teacher. So on one occasion I found myself working with a surgeon who was brilliant at performing the old-fashioned cataract surgery, but was just learning the new technique of cataract surgery. And actually during that 6 months, he was helping me develop the old-fashioned techniques so that I know all those. I'm one of the few surgeons still operating who know how to do all the old-fashioned cataract operations, extracapsular, I've even performed intracapsular cataract surgery. But also I was teaching him how to perform modern small incision phacoemulsification cataract surgery. And that was an extraordinarily valuable learning experience which allowed me to become a teacher quite early on in my career for the junior ophthalmologist following on behind me when I was a registrar. When I was 4 years into my training, I realised that I'd mastered all the techniques to treat all the different kinds of cataract surgery, so I decided to teach myself to become ambidextrous. So I was a right-handed cataract surgeon and I developed a program for myself in the wet lab to learn all of the techniques left-handed, and I turned that into a teaching program for the Royal College at their annual meeting. So that really left me in a strong place for adjusting my incision depending on the patient's anatomy. If the access was a little bit difficult, I just changed hands. If I was teaching a surgeon who was left-handed, that was no problem. I'd say, just set it all up for you to be comfortable. I can take over left-handed, that's no problem. Since that time, I've been privileged to work as a consultant independently in Leeds Teaching Hospitals, one of Europe's largest teaching hospitals. And I inherited a very large, complex anterior segment practice. So anterior segment is cataract surgery, but everything around it. And so that practice involved really operating on the most difficult cataracts. So the cases where other surgeons would say, I don't really want to take this on, I think this is looking quite complex, quite difficult, and they'd be referred to me. And so it was a real privilege to look after these patients and see them through to a good outcome. And then in more recent years, I've been privileged to work with companies who've been developing refinements and new technologies in cataract surgery. So for the last 4 years, I've been using the femtosecond laser for cataract surgery. We now have that technology in our NHS practice at St James Hospital in Leeds, as well as in our private hospital. And that's been very interesting. It hasn't been the great leap forward that phacoemulsification surgery was, but it's been an interesting technology and part of a continuing journey that I've enjoyed over 20 years. So although it may sound a bit sad to my orthopaedic friends, I still love it and I still really enjoy the surgery. And most of all, I still enjoy the impact that I see it has on people's lives, that I see in the improvement in the quality of their life after we've treated their cataract.